everyone, welcome to another episode of Excela Health Virtual Mall Walkers, and happy Mall Walkers Day. Since it's Mall Walkers Day, we have another featured physician presentation for you. October is Breast Cancer Awareness Month, and we thought it would be appropriate to share some information with you about women's health and wellness. Recently, Dr. Margaret Clark from Radiologic Consultants Ltd. was interviewed about a new technology that's now available at Excela Health called the Smart Curve System, which makes receiving a mammogram a more comfortable experience. We'll be sharing more later on in this video, but first, let's check in with Dawn to see what mystery food item she's using on another segment of What's in Your Pantry.
Hi everyone, welcome back to another show of What's in Your Pantry. And today is our last episode of Supermarket Savvy. And if you've been playing along with our supermarket scavenger hunt and you guessed the feature ingredient in today's recipe to be buckwheat groats, you are correct. So we are going to be featuring buckwheat groats in our recipe demonstration today. All the recipes in your email this week do feature a whole grain as an ingredient. So let's talk a little bit about buckwheat groats. So what are the health benefits of buckwheat groats? Okay, first off, they are gluten-free, okay, because buckwheat groats are the hulled seed of the buckwheat plant. They have a very mild flavor. They look and taste a little bit like steel-cut oats. And the best part of buckwheat groats is they are a very good source of high-quality protein and iron. Plus, they make an excellent addition to your favorite granola recipe. And that's what we're going to be making today. We're going to make a coconut buckwheat granola. So let's take a look at our ingredients. We have old-fashioned oats, we have flaked coconut, sliced almonds, pumpkin seeds, the buckwheat groats. We're going to be using some canola oil, some honey, and cinnamon and salt. Okay, so this recipe is super easy. It is chock full of whole grains. And I think you're really going to like this, okay? So I've made this several times. So we're just going to add all of our ingredients right here to the bowl. So I just poured in my oats. Next is the flaked coconut. Now, my flaked coconut is already sweetened, so I am not going to be using the honey in the recipe. Next in go the almonds. And then the pumpkin seeds. Now, if you don't have pumpkin seeds, you could use sunflower seeds, like the sunflower kernels that we talked about in a prior episode. You could also use any kind of nut as well, as if you don't have almonds. I think, pecans or walnuts would also be very tasty in this recipe. So now we're going to add our buckwheat groats. We're going to give this a nice stir. All right, because we want this all mixed up nice and even. Okay, that looks good. All right, so now we're going to take our canola oil, and to it we're going to add the salt and the cinnamon. We're going to stir this up a little bit. Okay, so this is what's going to give our ingredients in this bowl some flavor. Well, the cinnamon smells really nice. Okay. So I mentioned about buckwheat groats being perfect for our granola recipe. Buckwheat groats are most commonly used in like a porridge or ground up to make buckwheat flour. Okay, so we're just going to stir. I poured in the oil with the salt and the cinnamon, so we're just going to keep stirring this to make sure that everything is nice and coated. All right, that looks pretty good. All right, next we're going to take our cookie sheet or sheet pan, and we are going to pour give you a look here, see what that looks like. We're just going to pour this mixture right on the sheet pan, and I've lined my sheet pan with parchment paper. And the reason I do that is because once this is done baking, it is super easy just to lift up the parchment paper by the corners and pour it into your airtight container. Okay, so this granola looks like it's nice and spread out. Let's use my hands a little bit to get it all nice and even because we want it to brown evenly. Okay, so there you have it. All right, so this is going to go in the oven. The oven is set at 375. And I already made a batch for you. Okay, so you're to bake this for about 20 minutes. I only did it half the time because I kept an eye on it because these grains cook up very fast. Okay, so the last thing you want is burnt granola. So this is my finished product, and you can see that I added some dried cherries and dried cranberries and dried blueberries to it, okay, because I like that extra boost of antioxidants. All right, so here's our granola. Okay, get a look at that. So this granola, like I said, super easy to make, chock full of fiber, protein, antioxidants, and a lot of flavor. You should smell this. The toasted nuts, the cinnamon, it smells like fall here in my kitchen. So, the healthy habit in today's episode is eat more whole grains, okay? Granola is a great way to get a lot of whole grains in your diet. And when you are in the grocery store shopping for your whole grains, you want to make sure that your product has this symbol on it. It is a yellow postage stamp, and this is an indication that this product has 100% whole grain. Okay, so you want to look for this whole grain stamp. And another thing you want to look for is on the ingredient list, make sure that you are getting whole grains. Okay, so look for the stamp, look for the ingredient list. So there you have it, a very healthy granola recipe, right? This would be perfect for breakfast, just mixed with some milk, or you could add it to some yogurt for a parfait. You could also toss this in a salad. This would give some nice crunch to your salad. So there you have it. I hope you give this a try. Thank you again for always tuning in. I hope you will stay with us when next month we talk about a new theme, and we are going to be discussing favorite fall produce. All right, so stay tuned for our next show. I have a lot of good recipes in store. I think you're really going to like the fall produce favorites. So until then, stay healthy, stay tuned, and we'll see you later. Bye-bye.
Welcome back, Mall Walkers. We hope you enjoyed Dawn's cooking demonstration and our healthy habits tip of the day. Be sure to check your email inbox for some additional content that we've sent to you, including 3 healthy recipes, an exercise challenge, a decompress your stress segment, and our thought of the day, plus 2 additional resources. One that talks about the health benefits of whole grains, and the other one talks about buckwheat groats, which is our featured food item in Dawn's cooking demonstration. So make sure you check those out. Up next, we have Dr. Margaret Clark from Radiologic Consultants Ltd, and she will be sharing about the new Smart Curve technology that's now available at Excela Health. Stay tuned and keep watching. That's all we have for right now, but we'll see you next time.
In Touch is a public affairs presentation of Broadcast Communications, Inc.
I'm Eric O'Brien, keeping you in touch with the community. Today on In Touch, we are talking about new technology at Excela Health that makes a patient more comfortable while providing the highest rate of accuracy during a radiology exam, in particular mammograms. Joining me today are radiologist Dr. Margaret Clark and Julie Manley, an Excela patient. Ladies, welcome to In Touch.
Thank you so much for having me.
Now, normally we talk about mammography and breast cancer during Breast Cancer Awareness Month in October, but the reality is, Dr. Clark, it's not just an October thing, is it?
No, it's not. October is our month when we're really highlighting breast cancer awareness, but breast cancer occurs all times of the year. There's no doubt about that. So it's really a good conversation to have 12 months of the year, not just 1 month of the year.
For the last 3 months, you really haven't been doing mammograms at Excela because of COVID-19. So how was that decision handled? How was it made? Was it made due to lack of appointments being made, or was that a medical team decision?
Well, that was a medical team decision, and actually a countrywide decision based on all of the medical societies. And it was only screening mammograms that were not being performed, and that was in an effort to keep our patients safe, maintain excellent social distancing. It doesn't mean that we didn't do any mammograms at all, not at all. Anybody who had any kind of symptoms, any kind of problems, we continued to do diagnostic mammograms. Mm-hmm. Certainly we had staff available that whole entire time for diagnostic mammograms, diagnostic breast ultrasounds, and breast MRIs for patients who did have problems, but we just eliminated the screenings to decrease the risk to patients of developing the COVID-19.
Sure, and it makes sense. And so in the introduction, I talked about a new technology that you have, which is called Smart Curve. So explain to us a little bit about how Smart Curve works and what someone can expect when they go for a procedure with using that.
Sure, and Smart Curve is a new type of we call it stabilization system, which is a good thing because all of our patients appreciate the fact that the word compression has a bad association. But
sure.
And stabilization system and the Smart Curve, there's two parts of that. The Smart Curve is a different shape of the paddle that is really designed to make patients more comfortable during the procedure. And I think the stabilization system part of that is a good terminology so that patients understand that the importance of having the breast stable and not moving so that we can get a good image. But it really has seemed to, the studies prior to us obtaining the paddle really seem to show a significant increase in patient comfort with this curved paddle. And so far, our patients are finding that as well.
Do you think that over the years that people avoided having the exam done because it was not a comfortable thing to do?
Oh, absolutely. Many of my patients have said that over the years, and I actually quite often have a conversation with them that when I was a resident, the technology was such that the image would have to be obtained and the patient would have to stay in compression and until the technologist moved away from the imager and went and actually hand released the compression.
Oh, goodness.
So over the years, we've had significant improvements, and for many years now, after the image is obtained, the compression releases automatically. So that's already been an improvement compared to years ago.
Sure.
But the Smart Curve paddle has a significant, seems to have a significant ability to improve patients' comfort. And because if we can find things small on mammography before things are felt on physical examination, the overall results for patients are so much better.
Yeah, I was going to say, I bet with improved comfort comes improved technology and so on. So you can probably see more than you could before, even with that old-fashioned equipment that kind of kept them prisoner for a little bit from the sounds of things.
Absolutely. And yes, the technology over the years, going from film screen many years ago to digital mammography and now tomosynthesis, has just made tremendous improvements in what we can see. And so we've made those improvements in visualization, and now we're also making improvements in comfort for our patients.
Now, what is Aspen Scoring? And there's a questionnaire and data registry that you participate in, but I assume that that's all one thing right there. What is it?
Yes, actually, and we started that in August. And the Aspen is an update to our mammography reporting system that we've had in place for years and years. And what the upgrade does is it's a lengthy process for the initial time that our patients have come into contact with it, because it involves a very lengthy questionnaire. And the patients are usually either doing it on an iPad themselves or with the assistance of one of our technologists. And it's a long series of questions to determine breast cancer risk.
Okay.
And what that does is then it then calculates a risk score based on the questionnaire. And that risk score, which also includes now breast density, helps the patient and her primary care provider decide whether she needs any supplemental screening of any sort. Depending on her risk factors, whether she would benefit by additional screening with breast MRI or breast ultrasound.
Mm-hmm. And what is breast density? Why is this information so important in regard to that?
Breast density is very, very important. It's always been known to be important. Well, let me back up and say that there are 4 different types of breast density. There's the fatty breast, which is almost completely black. And then there's the extremely dense breast, which is almost completely white. And then the 2 categories in between time, the scattered fibroglandular density and the heterogeneously dense breasts, are, somewhere in the spectrum in between. And we've always known that breast density is important because when you have a very white breast, masses are white and cysts are white. So as you can imagine, seeing those white masses and those white cysts against a white background is much more difficult than seeing those white masses and white cysts against a nice black fatty background.
Sure.
So that's always been an important thing when we've read mammograms. But newer research has shown that there's a significantly increased incidence of breast cancer in people with dense breasts. It's actually an independent risk factor for breast density or for breast cancer. Mm-hmm. Like, for example, people with a family history of breast cancer have a higher risk of developing breast cancer compared to people who don't have a family history.
Okay.
So likewise, people who have dense breasts have a higher risk of developing breast cancer compared to people with fatty breasts. And so that's a very, very important part of the risk calculation. And it's also a very important part in determining whether patients require additional supplemental screening with breast MRI and or breast ultrasound.
Now explain the MRI and the ultrasound in relation to a typical mammogram. Why aren't they just used as a regular exam feature?
There are multiple reasons. Certainly, breast MRI is a very costly study.
Okay.
It is a very lengthy study. It requires about 45 minutes.
Oh, wow.
And it requires contrast. So as you can imagine, it's pretty hard to do a 45-minute exam on millions of women in a timely manner.
Sure.
And the other thing about breast MRI is it's very sensitive, but not as specific. So what that means is we find a lot more benign things on breast MRI that cause concern and lead to more recalls and more benign biopsies compared to mammography alone. However, in the setting of dense tissue, especially in people with high risk, it is very, very sensitive and finds things that we might not see on mammography.
I see.
Likewise, ultrasound. So many of our patients think that ultrasound, it's a one or the other, either mammography or ultrasound, and you have your choice. Unfortunately, they're very complementary studies. And similar to breast MRI, ultrasound can lead to more recalls, more follow-ups, more biopsies that end up being benign, but the studies have shown that if you take 1,000 women, we will find 2 to 3 more breast cancers if you add ultrasound in the appropriate clinical setting compared to mammography alone.
Wow.
The great thing about ultrasound compared to MRI is it's a shorter exam, and it's certainly less costly than MRI too.
Okay. Now, again, the results come in from the mammogram and so on. How do you communicate these to the patients, and what happens, and how quickly after it do you have the results?
Well, certainly we try to get the results to our patients as quickly as possible. Everybody understands that waiting is one of the worst parts of any step in the whole procedure. Mm-hmm. But when a patient comes in for a screening mammogram, the mammogram is read. The patient has their mammogram and then they leave, and the screening mammogram is read, usually in a group with a whole bunch of other screening mammograms. Mm-hmm. And the report is dictated, and patients are given a category. And category 1 is negative, category 2 is benign, and then category 0 means needs additional imaging. Okay. And in the case where the radiologist gives the patient a category 0 from screening, then that is immediately goes to a system where one of our secretaries calls those patients back and schedules them for the additional imaging, whether it being additional spot compression views or whether it's a breast ultrasound. Okay. And certainly we work very hard to get our patients back as quickly as possible.
Yeah. So it's a matter of days, but it still takes some time to get it back, and even with the technology you have available now, right?
It does, yes. I mean, the technology, it still takes time, because especially when we do have our patients come back and we're doing the extra mammographic views or the additional ultrasound views, in that case, it's different from the screening. The radiologist is actually looking at those images right when the patient is there, and then the patient immediately gets feedback from either the technologist or the radiologist.
Okay.
So it may be some waiting between screening and getting that call back, but when the patients do come back, we do give them results immediately.
Okay, that makes sense. You're listening to In Touch. I'm Eric O'Brien, and today we are talking with radiologist Dr. Margaret Clark about mammography and breast imaging, including a new technology at Excela Health called Smart Curve. Sounds a little more comfortable than it used to be, for sure. And one patient who has experienced this process is Julie Manley, who is also on the line with us. Julie, first of all, welcome to In Touch. And why are these procedures important to you?
Hi, Eric. Thank you so much for having me. Well, when I got the call to do this, I was actually happy to do it. I have been getting mammograms probably since I've been 35 years old. I have had some callbacks in the past, and luckily I was fortunate enough nothing ever transpired from all this, so I was very fortunate that they all came back okay. And like Dr. Clark said, they can be kind of uncomfortable. So just on June the 11th, I went out to the Norwin Square at 7 o'clock. They were only doing mammograms at 7 in the evening due to the COVID. Mm-hmm. There was nobody else there besides me. They were scheduled every half an hour, so it was nice social distancing. All the rules were followed. When I went in, I didn't expect to have the new technology done, and I'll tell you what, it was not a bad experience at all compared to what I've had done in the past. It was very comfortable, very quick, and I got my results back probably within a week. And like I said, I would not hesitate to recommend this procedure to anyone.
So you've had quite a number of exams, over the years. You usually do this, every year?
Yes, I try to be very proactive because I have had some issues in the past. Mm-hmm. And so I try to, I've never missed, probably since I've been 35 years old, once a year, I do my annual screening. Okay.
So, and this was a first for you, and it was a total surprise from the sound of it, how comfortable it was.
Actually, it was. I, expected the same, mammogram that I had last year, I mean, they're not horrible, but it's not the most pleasant experience that you
Sure.
that you have. But this one, I like I said, I had no idea that they had since moved to the Smart Curve, and it made such a difference, I think. And it was great. It was good. Like I said, I would highly recommend it. Anybody that might have that fear of going to have a mammogram, it really is not a bad experience at all.
And in addition to the experience, did you find that the results were a little more detailed or a little bit more than you knew before from prior exams?
Well, usually, like Dr. Clark said, after they complete your mammogram, you leave. And I have actually been one of those patients that have gotten those callbacks for you to come back in to have more screening done. This time, I hadn't heard anything for a couple days, and probably within a week, I did receive my letter, and it was in detail as to, what the findings were. I am a patient that falls into the breast density. I do have dense breast, so it did go in and explain all about that. But it was very efficient.
Good. And now, did you have your appointment scheduled before everything shut down for the 3-month period, or was this an appointment that you made after this? And how easy was it for you to get the appointment?
Usually my screenings are in May, but that was still kind of in the time that things were still kind of shut down a little bit. So what I did is I did call the scheduling number, and I was able to get in on June 11th, which was maybe 2 weeks after the date that I should have been there. At the time, they explained to me that they were only having evening appointments due to the COVID. It was maybe like 3 or 4 days from the time that I called. They had times available. I just picked my time. They told us just to show up. Usually, you're to show up 30 minutes prior to your mammogram. They said, please just come at 7 o'clock.
Wow.
When I showed up at 7, everything was done verbally. No pens were used. Nothing. No papers were signed. They took you right back, and within 5 minutes, I was back with the person that did my screening, and took maybe 5 or 10 minutes, and I was on my way. Probably 20 minutes to a half an hour in all. Wow!
So you're really efficient and in and out, and all taken care of, and you got good results this year.
Yes.
So good for you. It's wonderful news.
Thank you.
For sure.
Thank you.
Speaking of that, Dr. Clark, you have no doubt a pent-up demand for exams, since nobody could come in if they were just doing a routine screening. So I'm sure you have a big backlog of appointments to fulfill. How are you handling that right now?
We've been expanding our hours. As Julie said, we've been doing mammograms even in the evenings. One of the other things that we've done from a safety standpoint, which is disappointing certainly for some patients, is we're not doing mammograms at Westmoreland Hospital at this point in time.
Okay.
And that is completely just for the safety of our patients. Our waiting room at the hospital did not accommodate social distancing, unlike our waiting rooms and our system at both Excela Square at Latrobe and Excela Square at Norwin, where there are individual waiting rooms for every patient. We couldn't accommodate that at Westmoreland, so at this point in time, we're not doing our mammograms there, but all of the technologists who worked at Westmoreland Hospital are now able to expand services at both Excela Square Norwin and Excela Square at Latrobe. And that's allowed us to really expand hours and availability to patients while still maintaining safety and social distancing. So we're certainly using all the resources we have, all the technologists we have to increase availability, not only at night, but actually we've even been doing mammograms on Saturdays and Sundays now too.
Okay.
And we just have a all hands on deck approach. We understand that it's a scary thing for people to have to wait, and we're just doing everything we can to make our process more efficient for our patients.
Now, of course, mammography is not the only imaging services you have. What other services of that nature do you have at the at Excela locations?
Just about everything that you can imagine. Again, we have breast MRI, we have breast ultrasound, but also ultrasound of any other body parts. We have MRI of other body parts. We have CT scans of all body parts and fluoroscopy. And again, we're just all working, especially with every patient having an individual waiting room. It's really helped us to help our patients stay safe with the COVID.
Sure. Well, looking ahead to October, are there any plans in place for programs and instruction on breast cancer awareness? And what are you working on in that regard?
Well, I should I could defer to Robin, but we certainly always try to do some lectures, some informative lectures. We the past few years we've had an evening for the public to come in to learn about mammography and breast cancer care in general. We've had panel discussions with breast surgeons, plastic surgeons, mammographers, and oncologists to incorporate the entire experience of breast cancer. So we try to make that available for our patients once a year too.
Robin, we do have Robin Jennings on the line. She is usually with us during these times. Robin is the Marketing and Communications Director for Excela Health. Robin, sorry to bring you on board so suddenly, but do you have any further plans in place for October yet?
Well, part of this conversation, Eric, has all been about how COVID has upended our life. And so it also makes planning for public events a little problematic because, as you know, the rules are quite, they're trying to be very careful about how many people gather. Mm-hmm. And I will tell you from the past events, and Dr. Clark is quite right, when we've had these events, the good news is they've been sellouts. The bad news is that's too many people in a room.
Right.
So, so we have to figure out how in this coming year that we will, not just for breast cancer awareness, but for all important health topics, because it's information that you want folks to have. So you never know. This could be one of those sign up for a virtual event. Uh-huh. And we certainly have been doing that to give people the opportunity to be part of maybe a Zoom program or a Cisco WebEx, because one of the things that has happened a lot for, as a benefit of COVID, if there are benefits, is that it's allowed us to do much more with telehealth. Mm-hmm. Now, obviously, Julie did not conduct her mammogram at home, but, in the privacy of her home.
Right. That would be interesting.
And, if we could do that would be an interesting experience. Yeah. But we've been able to do a lot more with telehealth visits for PCP visits, mm-hmm. Even some, specialist visits, follow-ups like with a cardiologist, but, some consultative sort of things. But it has allowed us to look, I guess, in all aspects of our life to be able to kind of get over those the barriers that maybe stopped us from using technology to its best use and bringing people into conversations with their physicians and programmatically doing that as well. So I think COVID may have helped us in that regard, to learn to do that differently and still engage with patients very well.
Yeah, as I recall, we had one of your doctors from the behavioral center on in May, I think it was, and we talked about this a little bit and how they have used telehealth for their program, and it turns out to be very beneficial in times of need, especially.
Well, it is, and one thing about what was good, and again, mammography and other diagnostic testing or preventive screenings, which do require different modalities of either imaging studies or lab work or cardiac at EKG. those do require you coming into a facility to have those tests. But, and that is what we're trying to help move people past, where, again, maybe someone delayed something that is preventive, and, certainly screening mammography is preventive. But what we were able to do in behavioral health is actually help some of the patients that normally would have presented to our emergency department who might have really been in crisis, let them know that they could continue to have services even if they were very hesitant to seek the service because they were afraid to come. But I do have to, Eric, I do need to make a commercial for, how we go out of COVID for all of our procedures. Julie mentioned how quickly we were able to facilitate bringing her into a private exam room, and Dr. Clark was talking about social distancing. Can't stress enough from Excela's point of view, and I'm sure other care providers, how important the use of a mask and the distancing in public. And, we all want to be back to normal. We do, whatever normal is going to be. But Westmoreland County has been so fortunate to not have the spike in cases that we've witnessed around the world. And I do believe that while it was, I'll call it painful, and probably it was more painful to us to stay home and stay in than it is for a woman to have a mammogram, because that's a brief moment in time. It's not 3 or 4 months of isolation from others. But I would say that what we did and what we will continue to do with screening as patients come in, when they come to their doctor visit, when they come to the appointment for a mammogram, we are going to ask screening questions. We are going to ask that people wear a mask. And that's really, my mask protects you, your mask protects me.
Absolutely.
And it's really going to help us continue to stay healthy.
Absolutely. You're 100% right. I couldn't agree more. And who do we call or where do we go on the website to schedule a mammogram or other radiology work?
Well, if you visit excelahealth.org, you can actually search Mammo. You can search and read more about Smart Curve, about the technology. And there you can also see where we are doing mammography. And if it's a screening mammogram, you're calling our centralized scheduling number, which is 724-689-0100. And the schedulers are available to help screen. We are currently not offering our Walk-In Wednesday program for the very reason of social distancing. And certainly that has been very popular in the past, where a woman could make the choice to come at her convenience, and we're just not able to do that at this time. And hopefully we'll be able to add that back into the flexibility in the future. But until we really believe that we've are safely being able to come together and let people, sit in waiting rooms while they wait their turn, every test is a scheduled test. You're not walking in for it.
Makes sense. We have been talking to radiologist Dr. Margaret Clark of Excela Health about the mammography and breast imaging, and Julie Manley, a patient, and our friend Robin Jennings of the Marketing and Communications Department. Thank you for joining us on In Touch today.